Hello everyone, this is Chadi from SIF 2023. I'm really privileged again to be with Megan Coylewright. She did a phenomenal talk about structural heart intervention in general, but specifically about quality of life as an outcome in clinical trial. Megan, thanks for being with us.
It is so great to be with you. This is year 3 now in a row for the two of us.
Yes,
yeah, very good.
Yeah.
So we did have a conversation today about the Triluminate trial. So the Triluminate trial is this trial of transcatheter tricuspid valve repair, and it was presented at the American College of Cardiology by Paul Saraja, who is the lead investigator, and published in the New England Journal. So Paul Saraja and I were on stage and we were talking about what led to calling that trial a success. And it was actually quality of life.
Exactly, because it's not a procedural success. There's part of it, right, as an outcome. Stroke, death, all this is, but the main outcome was quality.
That's right. In interventional cardiology, we're used to thinking about death and stroke as being the main hard outcomes that we're powering our trials off of, particularly with thinking about stents for STEMIs or aortic valve replacement for severe aortic stenosis. But now we're talking about tricuspid regurgitation. This is a disease that doesn't cause people to die suddenly, they just suffer for a long time.
Yeah. So quality of life, so how do you evaluate that in clinical trials? I know there is multiple tools, very objective ways, but the patients sometimes speak up, and you did a phenomenal video of recording your patients, how they feel.
This is a new outcome for us in interventional cardiology, and so we're still learning a lot about it. It's not new for other people, but in 2020 in JACC, there was a state-of-the-art review on the survey that we use to measure quality of life that we've adopted in our interventional trials, the Kansas City Cardiomyopathy Questionnaire, or KCCQ.
Yeah.
And that has been used in prior heart failure trials, drug trials, but it's kind of new to us for device trials.
Exactly.
And we did in this Triluminate trial measure death, going to surgery for tricuspid valve surgery, or having a heart failure hospitalization, but the groups didn't differ on any of those. So the fourth thing in that composite outcome was change in KCCQ score, how they rated their quality of life, and it was better for the group that received repair than those that didn't.
So I see the evolution of structural heart disease. If you remember, TAVR was only for prohibitive risk or extreme risk, and now we do the low risk. Do you see the Triluminate or the tricuspid intervention? Now we started with quality of life, but do you think we're coming to in the future to compete with surgical outcome?
Well, it's interesting about the evolution of our field, because I think one of the big changes, as you said, is getting into this realm of tricuspid repair. This is part of a larger group of trials that I would call interventional heart failure. You know, we're really trying to impact how patients feel with regards to their heart failure symptoms. And I would say that mitral regurgitation was kind of in that realm, but we also saw improvements in death and heart failure hospitalization. So more analogous would be the interatrial shunt trials, where we're just trying to make people feel better. Right. So I think as our field evolves, we actually evolve with other partners, which includes the FDA and CMS. How are they going to think about this as a primary outcome? Is it enough to get approval, for example, for a cardiac device? We haven't been down this road before.
No. Well, Megan, nice talking to you all the time, and especially for this important topic that as interventionists we just think about stent deployment, how to do the procedure, but ultimately how the patient feels.
That's right.
Thank you for being with us.
Thank you.
Watch this video and others on SIF YouTube channel, and this is SIF Conversations.